Welcome back, everybody, to the deep dive.
It's great to be back.
So today we're going to do a deep dive into strength training anatomy.
That was good.
Specifically, we're going to be looking at the materials you provided on how different exercises target specific muscles.
Right.
And, our mission is to kind of unpack this really detailed information and hopefully give you a better understanding of what's actually happening when you hit the gym.
Yeah, and how you can train smarter, not necessarily harder.
Exactly. And speaking of these materials, the star of the show today is Frederick Delaviere's Strength Training Anatomy.
Yeah, that's a classic.
It is. It's it's just packed with these incredible anatomical illustrations that really show you the muscles in motion.
Yeah, and I think that's what makes this book so powerful,
Right.
It's one thing to have, a list of muscles that are working during an exercise, but to actually see them, like, visually,
Yeah.
I think that's when it really clicks.
Yeah. So we're looking at these illustrations and the question is, why should we care about all these specific muscle names?
Right.
I mean, what's the real payoff for understanding this stuff,
Well, I think that there are a few key benefits.
Okay.
So first, it's about precision.
Mm-hmm. Yeah.
If you have specific physique goals,
Yeah.
like you want to build a bigger chest or, stronger legs or whatever it is, understanding which exercises target those areas most effectively
Right.
can really help you tailor your workouts.
So it's not just about like, oh, I'm going to go do legs today. It's like, I'm going to go do these specific muscles in my legs today.
Right. You can be a lot more strategic.
Gotcha.
And then, another important benefit is injury prevention.
Yeah, that's huge.
If you understand the mechanics of a movement, the stresses that it places on your joints, on your muscles,
Right.
you can choose safer exercises and execute them with better form.
Yeah, because you're not just blindly going through the motions. You're actually understanding, like,
Right.
okay, this is putting stress here. This is what I should be doing.
Yeah, it takes the guesswork out of it.
Gotcha.
And then ultimately, it's about maximizing your results.
Okay, how so?
Well, when you can visualize the muscles that you're working,
Yeah.
you can actually consciously engage them. And that creates a stronger mind-muscle connection.
Okay.
And that leads to more effective muscle stimulation and growth.
So it's like you're not just kind of hoping that you're hitting the right muscles.
Right.
You're actually like focusing on that.
Exactly. You're in control.
Gotcha. So let's start putting this into practice.
Okay.
And let's start with some upper body exercises.
Sounds good.
First up, the bench press, a classic.
Staple.
Yeah. So what's the anatomical breakdown of the bench press? What's going on under the bar?
Well, the bench press is really hitting your chest, shoulders, and triceps. And the primary movers here are the pectoralis major. That's your main chest muscle. And Delaviere's book does a really good job of showing how both the sternal portion, which is kind of like the middle and lower part of your chest, and the clavicular portion, which is the upper part, are both heavily involved.
Gotcha.
So, think of that clavicular head like kicking, especially when you're pushing the weight off your chest.
Interesting. Okay.
Then you've got the anterior deltoids, that's the front of your shoulders, and all three heads of the triceps brachii, which are on the back of your arms.
Okay, so it's not just chest. It's a lot of shoulder and tricep too.
Yeah, it's a compound movement for sure.
Gotcha. Are there any like smaller muscles that are also playing a role?
Yeah, for sure.
Yeah.
So you've got the serratus anterior, which helps stabilize your shoulder blade. That's really important for that lockout at the top of the movement.
Okay.
Then there's the coracobrachialis, which is a smaller muscle in your upper arm.
Okay.
It helps with shoulder flexion and adduction.
Gotcha.
And even the short head of the biceps brachii chips in a little bit.
Interesting. So it's like a whole team effort.
Exactly.
Now, you mentioned that the sternal and clavicular portions of the pecs are both involved.
Yeah.
But can we shift the emphasis between those two?
You absolutely can. And that's where different bench angles come into play.
Okay.
So, for example, if you want to really target that upper chest, the clavicular head, you would do an incline bench press.
Okay.
By tilting that bench upwards, you're changing the angle of resistance.
Right.
Which puts more emphasis on those upper pec fibers.
Gotcha. So it's all about the angle.
Exactly.
Okay, so let's say we're doing an incline dumbbell press.
Okay.
What muscles are we primarily hitting there?
So with the incline dumbbell press, you're still working your chest, shoulders, and triceps. But the emphasis shifts more towards that upper chest.
Okay.
So the primary movers are the clavicular portion of the pectoralis major,
Okay.
the anterior deltoids, and all three heads of the triceps.
Gotcha. And I'm guessing those smaller stabilizing muscles are still involved too?
Yeah, for sure, the serratus anterior coracobrachialis, short head of the biceps, they're all still contributing.
Gotcha. So if we compare that to a flat dumbbell press,
Okay.
what's the main difference?
So with a flat dumbbell press, you're shifting the emphasis more towards the middle portion of your chest.
Okay.
So the sternal portion of the pectoralis major is working harder.
Mm-hmm.
The anterior delts and triceps are still primary movers as well.
Gotcha.
It's just the angle changes the focus slightly.
So if you want to hit that upper chest, incline is the way to go.
Exactly.
Now, what if we want to really isolate that upper chest?
Okay.
Like focus on that squeezing motion.
Mm-hmm. That's where incline dumbbell flies come in.
Okay.
So with flies, you're minimizing the involvement of the triceps,
Oh, yeah.
and you're really focusing on the adduction of your arms,
Mm-hmm.
which is that bringing together motion.
Right.
And that's the primary function of the pecs.
Gotcha.
So on an incline, the primary movers are the clavicular portion of the pec major
Mm-hmm.
and the anterior delts.
Yeah.
And then the serratus anterior is helping stabilize your shoulder blades.
So that's a good one if you really want to zero in on that upper chest.
Exactly.
Okay, let's move on to another exercise. Parallel bar dips.
Okay.
Those feel like they work a lot of different muscles.
They do. It's a great compound movement.
So what's going on anatomically when we do dips?
So with dips, you're primarily working the lower portion of the pec major,
Okay.
the anterior delts and all three heads of the triceps.
Mm-hmm.
But what's interesting is that you're also engaging some back muscles.
Oh, really?
Yeah, so think of your lats and teres major,
Okay.
helping to extend your shoulders.
Mm-hmm.
And then the rhomboids and levator scapulae are helping stabilize your shoulder blades.
So it's not just a chest exercise, it's kind of a back exercise too.
Yeah, it's more of a full upper body movement.
Interesting. Okay, what about dumbbell pullovers?
Okay.
That one always felt like it kind of straddled the line between chest and back.
Yeah, you're right, it does.
So what's the deal with that one?
So dumbbell pullovers are unique in that they work both your chest and your back as primary movers.
Okay.
So you're hitting the sternal portion of the pec major,
Mm-hmm.
and then two big back muscles, the latissimus dorsi and the teres major.
Yeah, okay.
You've also got some secondary muscles helping out, like the serratus anterior, the long head of the triceps,
Right.
and some smaller back muscles for stabilization,
Right.
like the rhomboids, infraspinatus, and teres minor.
Wow. So it's hitting a lot of different muscles.
It really is.
Okay, let's switch gears now and talk about shoulders and back.
Okay.
And I want to start with something kind of interesting.
Okay.
Sometimes we use chest machines for shoulder work,
Right.
like using the pec deck for rear deltoids.
Yeah, that's a good way.
So how does that work anatomically?
So by reversing your position on the pec deck
Okay.
and focusing on pulling your arms backwards,
Mm-hmm.
you're essentially turning it into a rear delt fly machine.
Makes sense.
So the primary muscles you're hitting are the posterior deltoids, which is the back of your shoulders.
Mm-hmm.
And then you've got the infraspinatus and teres minor, which help externally rotate your shoulder,
Okay.
and the rhomboids and the middle and lower traps, which help retract your shoulder blades.
Gotcha.
And then the lats are assisting as a secondary muscle.
Interesting. So it's a good way to target those rear delts.
It is.
Now, what about cable rear delt flies?
Okay.
Are we
Yeah.
hitting similar muscles there?
Yeah, very similar.
Okay.
So cable rear delt flies mimic that same movement pattern.
Right.
You're still primarily working the posterior delts, infraspinatus teres, minor rhomboids, and middle and lower traps.
Okay.
Lats are still assisting.
Mm-hmm.
The main difference is that with cables, you're getting more consistent tension throughout the whole range of motion.
Okay, so that's a good option too.
It is.
Now, let's talk about those round-defined lateral shoulders.
Okay.
What's the best exercise for that?
So for those lateral delts, lateral raises are the go-to exercise.
Okay.
They really isolate that muscle.
Mm-hmm.
So the primary movers are the middle deltoids
Mm.
and the supraspinatus,
Yep.
which is one of your rotator cuff muscles.
Mm-hmm.
It helps initiate that abduction of your arm.
Gotcha.
And then you've got the anterior and posterior delts and the traps acting as secondary stabilizers.
Okay, so it's important to keep those other muscles in check.
Yeah, you want to make sure you're really targeting the lateral delts
Right.
and not letting other muscles take over.
Gotcha. Now, what about the upright row?
Okay.
That one seems to work the shoulders too.
Yeah, the upright row is a good compound movement for shoulders and upper back.
Okay, so what muscles are we primarily hitting there?
So with the upright row, you're working the middle and anterior deltoids,
Mm-hmm.
the upper and middle traps and the rhomboids.
Right.
And then you've got secondary muscles like the biceps brachialis and the infraspinatus and supraspinatus for stability.
Gotcha. Now, I've heard that the upright row can be a little risky for the shoulders.
Yeah, that's true for some people.
Is that something we should be concerned about?
Well, it depends on your individual anatomy.
Okay.
But for some people, that combination of internal rotation and abduction can lead to shoulder impingement.
So it's something to be aware of.
Definitely listen to your body.
Okay, good advice now. For those posterior shoulders,
Okay.
you know, the ones that are important for good posture.
Right.
What's a good exercise for those?
So for posterior delts and upper back reverse flies are a great option.
Okay.
Usually done bent over with dumbbells.
Mm-hmm.
And you're primarily working the posterior delts, the rhomboids, the middle and lower traps, the infraspinatus, and the teres minor.
Okay.
And the lats are assisting as well.
So it's kind of the opposite of a chest fly.
Yeah, exactly.
Okay, good to know. Now let's move on to back exercises.
Sounds good.
Pull-ups are a classic.
Yeah, a true test of strength.
And your materials specifically mentioned chin-ups facing the neck.
Okay.
How is that different from a regular pull-up?
So with chin-ups facing the neck, you're still using a supinated grip.
Okay, palms facing you.
Right. And you're pulling your chest towards your neck. And that really emphasizes the biceps.
Okay.
So the primary movers are still the lats and teres major.
Okay.
But the biceps brachii, particularly the long head, become much more involved.
Gotcha.
You're also working the brachialis and brachioradialis in your forearms.
Okay.
And then the posterior delts, rhomboids, lower traps, and even the lower pecs are acting as secondary stabilizers.
Wow, so it's still a compound movement,
Yeah, definitely.
just with a little more biceps emphasis.
Exactly.
Now, what about a standard reverse chin-up?
Okay.
How does that compare?
So the reverse chin-up also uses a supinated grip,
Okay.
but it generally engages a wider range of back muscles. So the primary movers are still the lats, teres, major biceps, brachialis, brachioradialis,
Okay.
and even the lower pecs. And then the secondary muscles are the posterior delts, rhomboids, and lower traps.
Okay, so it's similar, but maybe a little less biceps dominant.
Yeah, I would say so.
Okay, now let's say we want to target those lower lat fibers.
Okay.
Using a machine, what would you recommend?
So for lower lats, the back lat pull down with a narrow palms facing grip is a good option.
Okay.
That narrow grip allows you to really pull straight down,
Right.
which targets those lower fibers more effectively.
Gotcha. So what muscles are we primarily hitting there?
So you're working the lower lats, the teres major biceps, brachialis, brachioradialis, and the lower pecs.
Okay, and what about secondary muscles?
So the rhomboids, lower traps, and posterior delts are helping out for stability.
Gotcha. Okay, last back exercise.
Yep.
Let's talk about the T-bar row.
That's a good one.
Yeah, it's a classic for building that thick mid-back. So anatomically speaking, what's happening during the T-bar row?
So the T-bar row is really hitting those middle fibers of the lats.
Okay.
Along with the teres major rhomboids and the middle and lower traps. All those muscles are working together to pull the weight towards your torso.
Right.
And retract your shoulder blades.
Gotcha.
And then you've got secondary muscles like the biceps posterior delts.
Right.
And the erector spinae, which is stabilizing your lower back.
So it's great exercise for overall back thickness?
Yes.
Okay, so we've covered a lot of upper body exercises.
Yeah, we have.
Now let's move on to legs.
Okay, let's do it.
And I want to start with the king of leg exercises, the barbell squat.
The squat is a classic.
It is. So what's the anatomical breakdown of the squat?
So the squat is really a full body exercise. But focusing on the legs, the primary muscles involved are the quadriceps.
Okay.
All four heads of it, the vastus lateralis, vastus intermedius, vastus medialis, and the rectus femoris. Then you've got the gluteus maximus and the adductor magnus, which is in your inner thigh. It plays a surprisingly big role in hip extension during the squat.
Interesting. Okay, what about secondary muscles?
So you've got the hamstrings, the biceps, femoris semitendinosus, semimembrosus, your calf muscles, the soleus and gastrocnemius, and then the erector spinae in your lower back, which is keeping your spine stable.
So it's a lot of muscles working together.
It really is.
Okay, now what about the stiff-legged deadlift?
Okay.
How is that different from the squat?
So the stiff-legged deadlift is really targeting the posterior chain.
Okay, the back of your legs.
Exactly. So the primary muscles are the hamstrings, the gluteus maximus, and the erector spinae.
Okay.
And then the adductor magnus and the soleus are acting as secondary stabilizers.
So it's all about keeping those knees relatively straight.
Yeah, that's key.
Okay, to really emphasize the hamstrings.
Exactly.
Gotcha. Now let's talk about the conventional deadlift.
All right.
That's another one that's considered a full body exercise.
Yeah, it's the ultimate full body strength builder.
So what's the anatomical breakdown there?
Well, with the conventional deadlift, you've got so many muscles working together.
Okay.
So in the legs, you've got the quadriceps, hamstrings, gluteus maximus, and adductor magnus,
Mm-hmm.
all helping to lift that weight.
Right.
And then in the back, you've got the erector spinae, trapezius, rhomboids, and lats,
Okay.
all stabilizing your spine and pulling the weight. And then your forearms are working hard to grip the bar.
So it's like every muscle in your body is contributing.
Pretty much.
Okay, now what about the sumo deadlift?
Okay.
How does that wider stance change things?
So the sumo deadlift with that wider stance and more upright torso
Mm-hmm.
does shift the emphasis a little bit.
Okay.
You're still working all the same muscles,
Right.
but you'll generally see more activation of the vastus medialis,
Okay.
which is that teardrop muscle in the inner quad,
Mm-hmm.
along with the gluteus maximus and the adductor magnus.
Okay.
The hamstrings are still working hard,
Mm-hmm.
and the erector spinae is still stabilizing your spine.
Right.
It's just the angles are a little different, so the emphasis changes slightly.
Gotcha. So sumo deadlifts are a good variation to include.
Yeah, for sure.
Okay, now let's talk about hamstring isolation.
Okay.
What's a good exercise for that?
So for isolating the hamstrings, lying leg curls are a classic choice.
Okay.
They directly target the biceps femoris, semitendinosus, and semimembranosus, which are the three muscles that make up the hamstrings.
Okay.
You've also got some secondary muscles in the lower leg helping out,
Right.
like the gastrocnemius, sartorius, gracilis, and popliteus.
So they're primarily for knee flexion.
Exactly.
Okay, what about good mornings?
Okay.
That one seems to hit the hamstrings and lower back pretty hard.
Yeah, good mornings are another great exercise for the posterior chain.
Okay.
So you're primarily working the hamstrings, gluteus maximus, and erector spinae,
Mm-hmm.
and then the adductor magnus and soleus are assisting.
Okay.
It's important to start with a lightweight, though.
Yeah, why is that?
Well, because there's some potential stress on the lower back.
Right.
So you want to make sure you're using good form.
Okay, good advice. Now let's move on to the inner thighs.
Okay.
What's a good exercise for those adductor muscles?
So for adductors, the seated hip adduction machine is a good choice.
Okay.
It isolates those muscles really well.
Mm-hmm.
So you're hitting the adductor, magnus adductor, longus adductor, brevis gracilis, and pectineus, and then the sartorius is assisting.
Gotcha. So those are the muscles that bring your legs together.
Exactly.
Okay, now let's talk about glutes.
Okay.
The glute bridge has become really popular lately.
Yeah, it's a great exercise.
So what muscles are primarily working during the glute bridge?
So the glute bridge really targets the gluteus maximus and the hamstrings.
Mm-hmm.
And then the quadriceps erector, spinae, gastrocnemius, and soleus are acting as stabilizers.
Okay.
It's a good way to work your glutes without putting too much stress on your spine.
Gotcha. Now what about the outer hips and glutes?
Okay.
What's a good exercise for those?
So for outer hips and glutes, floor hip abduction is a good choice.
Okay.
It targets the gluteus medius, gluteus minimus, and the tensor fasciae latae,
Okay.
which are the muscles that abduct your leg.
Mm-hmm. Move it away from your body.
Right. And then the sartorius piriformis and other external rotators of the hip are assisting.
Gotcha. Okay. Last couple of leg exercises.
Right.
Let's talk about machine variations.
Okay.
So the angled leg press and machine squats. Mm-hmm.
What are the primary muscles involved in those?
So the angled leg press is a compound movement that works your quads, glutes, hamstrings, and adductors.
Mm-hmm.
And then the calves are helping out too.
Okay. And what about machine squats?
Machine squats are similar.
Okay.
They're primarily targeting the quads and glutes,
Mm-hmm.
with the hamstrings, adductors, and calves acting as secondary movers.
Gotcha. So those are good options if you need a little more support.
Yeah, or if you find free weight squats too challenging.
Okay, great. Now let's move on to the core.
Sounds good.
Let's start with crunches.
A classic ab exercise.
Yeah, so what muscles are we primarily working during crunches?
So crunches are mainly targeting the rectus abdominis.
Okay, the six-pack muscle.
Right. And then the internal and external obliques, which run along the sides of your torso.
Mm-hmm.
And then the transversus abdominis, which is your deepest core muscle,
Right.
is acting as a stabilizer.
So crunches are good for the upper abs.
Yeah. They're most effective for that upper portion of the rectus abdominis. Okay, now what about inclined board crunches?
Okay,
How do those differ?
so inclined board crunches increase the range of motion,
Okay.
which makes the exercise more challenging,
Mm-hmm.
but the primary muscles are still the same.
Okay, so it's the same muscles, just working harder.
Exactly.
Gotcha. Now what about leg raises?
Okay.
Like on a gym ladder or hanging from a bar?
Those are great for targeting the lower abs.
Yeah, they really feel it down there.
Mm-hmm.
So what muscles are we working with leg raises?
So with leg raises, you're hitting the lower portion of the rectus abdominis,
Okay.
the iliopsoas, the tensor fasciae latae, and the sartorius,
Okay.
which are your hip flexor muscles,
Right.
And then the obliques and quadriceps are assisting.
Gotcha. And hanging leg raises seem particularly challenging.
Yeah, they are.
Why is that?
Well, because you need a lot of core stability to control that swinging motion.
Right. You can't just let your legs flop around.
Exactly.
Okay, now what about bench sit-ups, where your knees are bent and your feet are tucked under supports?
So those bench sit-ups are really working the entire rectus abdominis,
Okay.
the internal and external obliques, and the iliopsoas. And then the quads are helping stabilize your legs.
Okay.
And the fixed position of your feet allows for a really strong contraction of those abs.
So it's kind of a more complete ab exercise?
Yeah, I would say so.
Okay, now what about Roman chair sit-ups?
All right.
Those look pretty intense.
They are.
So what's going on there anatomically?
So Roman chair sit-ups have a really big range of motion, which makes them very challenging.
Okay.
So you're working the rectus abdominis, internal and external obliques, and the iliopsoas.
Okay.
And then the erector spinae muscles in your lower back are working to control the descent.
Gotcha.
And the quads are stabilizing your legs.
So it's a full core workout.
Yeah, for sure.
Okay, now how about incline leg raises?
All right.
How do those compare to like flat or hanging leg raises?
So incline leg raises are similar to hanging leg raises.
Okay.
In that they target the lower portion of the rectus abdominis and the iliopsoas.
Okay.
And then you've got the obliques, tensor fasciae latae, and sartorius assisting.
Gotcha.
The nice thing about incline leg raises is that you can adjust the angle to make it easier or harder.
It can kind of work your way up.
Exactly.
Okay, last set of exercises.
Okay.
Let's talk about side bends.
Right.
So you've got dumbbell side bends and machine side bends. What's the main focus there?
So side bends are all about targeting those obliques.
Okay. The sides of your core.
Exactly. So you're working the internal and external obliques.
Okay.
And the quadratus lumborum, which is in your lower back. And then the rectus abdominis and erector spinae are acting as stabilizers.
So those are important for developing a strong and balanced core.
Absolutely.
Okay, so we've covered a lot of ground today.
We have.
We've gone through a ton of exercises and really broken down the anatomy.
Yep.
So what's the main takeaway here?
Well, I think the key takeaway is that understanding the anatomy of strength training can really revolutionize your workouts. You know, when you know which muscles you're targeting, you can choose exercises more effectively. And you can really focus on those muscles while you're training.
So it's not just about going through the motions.
Exactly.
It's about being mindful and intentional.
Right. And that's how you get the best results.
So I encourage everyone listening to really think about the anatomy as you're working out.
Visualize those muscles.
Right.
Feel them working.
And use that knowledge to make your workouts more effective.
Absolutely.
All right. Well, this has been another great deep dive.
It has.
Thanks for joining us.
Thanks for having me.
And we'll see you next time.
See you later.